So at this point, the sheep's head would be up here, obviously, because this is the trachea. And then its legs would be up in the air, right? So it's laying down with its legs up in the air. That means that this is the ventral side. So ventral can also be referred to as anterior. All right? So they cut away the heart, which has a lot of fat surrounding it. And then here at the very bottom, this used to stretch out and help with inspiration, expiration. What is this?
Diaphragm.
The diaphragm, good. So the diaphragm looks like well-done steak, I always say. And we'll remove that to be able to identify diaphragm. And then they removed the trachea. Now with the trachea, remember histologically, we can identify the different types of tissue and epithelial lining. So what type of tissue would be towards the lumen?
Ciliated columnar epithelial tissue.
Pseudostratified ciliated columnar ET. Good. All right, so that means that it has cilia. So if you take a glove and rub it against the lumen, you can feel a velvet-like feel to it because the cilia is catching onto your glove. Now on the outside, you can feel the hyaline cartilage because it's rough and it acts as a protective layer for the trachea. All right, so we have it like this, and then eventually some of the bronchioles will jut into the lungs themselves. And then we have the primary bronchus. So on either side, we have a primary bronchus. Here's one, and if you have a glove, you can feel it. Okay, and on the other side, we have another primary bronchus. Okay, and it still has that hyaline cartilage feel to it because it's still kind of a part of the trachea, right? Okay, so let's again orient ourselves. This is the ventral side. Is this right or left?
Left.
Left, and we know because it has two lobes. 1, 2. Is this the right or the left then? This is the right. 1 lobe, 2 lobes, 3 lobes. And for sheep, it's smaller up top, larger at the bottom. Versus humans, where it's larger up top, smaller at the bottom. Okay, so if we're going to label the lobes, you can see at the yellow, what is that?
Superior.
Left superior lobe. You always want to differentiate left versus right. At the blue, what is that? Left inferior lobe. How about here?
Right superior.
Right superior.
Right middle.
Right middle. And
Right left.
right inferior lobe. All right, don't worry about identifying the fissures on the dissections, but on the Joey models, you should be able to. So the fissure that separates the right superior from the right middle lobe
Horizontal.
is the horizontal fissure. And then the one that separates the right middle from the right inferior, oblique fissure. Right oblique fissure. Now on this side, since we only have 2, what separates the left superior from the left inferior lobe? Oblique fissure. Left oblique fissure. Good. All right. So again, what side of the lungs are we looking at here?
Ventral.
Ventral. So if we flip him over, and he's standing on all 4s, this is what side of the lungs?
Dorsal.
Dorsal. Also known as posterior. All right, so posterior is prettier, it's smooth, and it looks like a stingray. The anterior or ventral side is then ugly.
Makes sense.
Which one's prettier? Okay, so then, and I'll flip this so that you guys can see and you guys can see. Yellow, if you have a glove you can feel it too, is what structure?
Primary bronchus.
Primary bronchus, right? All right. Now, since we just went over vessels, which has the thicker tunica media? Arteries or veins?
Arteries.
Arteries. So, the arteries will be superior to the primary bronchus. See that? Superior, inferior, superior, inferior. Right? So then the veins will be really thin in comparison. And normally you'll find them inferior to the primary bronchus. So you can see the difference there. So you can see at the blue, the tunica media looks like it can hold up on its own, but at the red, it looks really thin and it eventually collapses, right? So in order to keep things straight throughout, first identify the primary bronchus, which is at the yellow, right? Superior to the primary bronchus, we have what vessel?
Pulmonary artery.
Pulmonary artery. Okay, so that means that next to it, we have the superior lobe. Now on this side, what lobe is this?
Right. No, left superior.
Left superior lobe, because it's smaller, it's closer to the pulmonary artery, right? And then also on this side,
Right superior.
this one would be right superior because it's smaller than this and it's closer to the pulmonary artery up here.
What is the
Right.
hilum?
The hilum is just where all of the tubes come in.
So just that
So
general
pretty much
area.
this entire area.
Okay.
Yeah. Here and here is the hilum. All right. So yeah, just know what side are we looking at? Ventral. If we flip it, it's dorsal. What structure are we looking at? Here, at the yellow.
Bronchus.
Primary bronchus. What structure are we looking at the blue pin?
Pulmonary artery.
Pulmonary artery. At the red?
Pulmonary vein.
Pulmonary vein. So then, what lobe is that?
Left inferior.
Left inferior because it's closer to the pulmonary vein. What lobe is this?
Right. No, inferior. Right inferior.
Right inferior because it's larger and it's closer to the pulmonary vein here. Now, if we flip it over, you can also see that. It might be a little bit more clear, actually. Smaller, larger. So we have the right superior, right middle, right inferior. Okay? And then same with here. Smaller lobe, larger lobe. Left, what?
Superior.
Superior,
Inferior.
and left inferior. Always determine left versus right. Okay? Alright, so I'll leave this out for you guys to take a look at.